Tell us about your journey to the clinical lab.
So this is a story that I've told others in my field that don't know a lot about me. I actually went through a undergraduate degree for microbiology and followed that up with a master's degree in virology, where I did actual wet lab research on poliovirus and antiviral proteins. Those two degrees, I thought that I was going to hop right into the medical laboratory in a hospital. And as you know, and many people know, that that's very difficult to do without a MLS or specialist credential. So what I did was I went to the Department of Health in Austin and fortunately found a career path in public health. So I became a public health microbiologist in 1992 and spent a decade there. And it absolutely was a wonderful experience. I was able to work in newborn screens. And then I eventually moved into virology, virus isolation, where we did cell culture and CPE analysis and monoclonal antibody typing and even some early PCR work for really all types of viruses. So that was really great training. And it was during this time that I started recognizing people with med tech or medical lab professional on their name tags. And so I was educated quickly by these individuals that, that is a credential that's unique, that allows you to practice as a medical laboratory scientist. So I immediately went through the work route. I documented my working experience and I set for the SV, the specialist in virology, and that got me my first credential. And in the meantime, I went to work for this area in rabies and arbovirus. And this is the story that I really like to tell because it was a very unique position at the Department of Health. It was a brand new position that allowed me to work about 50% of the time as a bench level molecular epidemiologist. And the other part of my time was out in the field, actually doing field work with epidemiologists and things like that. In 1994, Texas was experiencing 2 rabies epizootics, and it was even a public health emergency that was called by the governor. So we embarked on this journey of something known as the oral rabies vaccination program. And it sounds weird now to think about it, but during this pandemic we're experiencing, but we were actually back in 94 started aerially distributing recombinant rabies vaccine to wildlife all over South Texas and parts of West Central Texas to immunize coyotes, fox, and other canines. And up to that time, we'd had a couple of human deaths and just thousands of animals succumbing to the disease. And within about 6 or 7 years, we had eliminated canine rabies from Texas. So that really whet my appetite early on for international public health experience. Working with CDC, I did a couple of visiting scientist internships at CDC and trained with some of the world's greatest rabies virologists. Started the rabies reference laboratory typing lab at the Department of Health in Austin. And so that's really was where I got my start in virology. And then in 2002, I had the opportunity to transition back into academia, back to my alma mater at Texas State University. And here I am now, kind of worked my way up through the professor ranks, and now I sit as chair and Regents professor for the Clinical Lab Science program at Texas State University.
Can you share some career highlights with us?
Up until that point, truly, and I talk about this with my students all the time, public health is absolutely a wonderful career path for medical laboratorians. And it's an area that you might recognize as one that you often can work on, big types of events, big outbreaks. So certainly working on the oral rabies vaccination program is really a major highlight of my career. I still work in the area of rabies. I still write. I published a book back at the beginning of the pandemic on clinical kind of aspects of rabies. So I'm intimately involved in rabies work. Other things that were really cool for me back in that time frame was working on a rapid response team where we would go out and work areas of Texas when they had experienced a death from hantavirus. So we would actually collect and trap rodents and then do necropsy and look for hantavirus in and around areas of death. We did plague collections. We did different types of mosquito collections to look for arboviruses. So just all sorts of surveillance projects that were just, again, just fantastic time in my career. More recently, really some of the highlights of my career have been working with students and doing research in the area of antibiotic resistance. One of my other primary research areas is MRSA work and other antimicrobial resistance issues, and just really becoming an advocate and passionate supporter of the medical lab. As we all know, others need to know about what we do. And so, that teaching component, that mentoring component in the latter part of my career here at Texas State has been truly a highlight for me.
Why haven't more people considered public health careers in the past? And do you think this is changing now?
Back in 1992, you didn't really hear it a whole lot in the world of microbiology and biology. Most people were thinking research, going back into like a PhD kind of setting or perhaps industry. But I think what has helped, obviously, are these ongoing threats around public health, whether it's water, like we saw in Flint, Michigan, whether it's West Nile virus that swept our country back in the early 90s, or anthrax. You might remember the anthrax issues back around early 2000, avian influenza. I could just go on and on. And certainly the current pandemic has put a big spotlight on public health from the laboratory, but all the way up through the programmatic areas of control and prevention in those areas. So it's absolutely a wonderful career path. And I often tell my students, I consider myself a hybrid professional. I really have one foot in the world of public health, one foot in the world of medical laboratory healthcare, and they really do synergize with each other. You really can't have one without the other. It's just that public health is a little less stat. As you know, in the hospital, things are all about turnaround times and really rapid testing. Healthcare, you want to get that answer, but you also are typically given a little more time to work on problematic cases and more global issues.
What's your favorite part of your work?
I would say, again, I really have to focus on the students. That probably the most interesting and fun aspect of my career now is involving students in my advocacy efforts and my research efforts around what I do from the standpoint of antibiotic resistance, as well as introducing them to things like explainer articles. I am a contributor for the American Society for Microbiology. I'm a contributor for ASCLS and ASCP, and just learning how to integrate students' learning framework for writing and speaking and looking for internships and fellowships. It's just really exciting for me because others did that for me back when I was a student. So I'm trying to pay it forward a little bit. And that is probably the biggest reason. It's really the fuel that keeps me going. Some of the administrative duties now as a chair, and I'm also the associate director for the Translational Health Research Center here at Texas State, which is a university level research center. Sometimes those get a little frustrating and trying, as anyone who's done administration. So that's probably the least favorite part of my job, but teaching, mentoring, conducting research and working with students and colleagues and alumni are still kind of the highlights of my career at the moment.
What's the most interesting thing you've experienced in your career?
I'm going to go back to my public health days because, again, when I came out of 2 degrees, I never in my life dreamed I would be working in the world of rabies. And to work in the world of public health rabies is truly a unique experience. For example, what most people don't realize is that testing for rabies means that you are almost always going to be utilizing brain material. And so unfortunately, that often means that animals that have succumbed to the disease or have been captured and perhaps euthanized for testing are sent to the public health departments around the country, and Austin is no different. And so on any given day, especially in the summer months when things got warm and rabies was a little more rampant because of exposure to people outdoors, we could have up to 100 animal heads shipped to us, and typically shipped to us via Greyhound bus, believe it or not. in containers. And so part of my early training was how to do necropsy. So again, I never in my life thought I would learn how to do an autopsy basically on an animal head, how to open the skull properly, how to extract the brain and the different components that needed testing. And also the crazy things that you would see that people would send in. For example, animal heads sent in paint cans that had been welded shut, or bats that had been sent in all sorts of clothing, including underwear, where people had trapped them from flying around in their house, and then they just threw it in a box and would send it to us. So you usually would liven up the morning on any given morning in the rabies necropsy lab when we received those types of samples. So those were interesting times. And then when I was on the oral rabies vaccine program and we were out in the field, we often were in South Texas, deep South Texas, and there would be, I don't know, 30, 40, 50 people from the health department, from the CDC, from the military, the Texas National Guard, a variety of wildlife biologists, a lot of veterinarians, and even the Canadians. The Ontario Ministry of Natural Resource would send their twin Otter aircraft for us to utilize. And so I would spend sometimes from dawn till dusk flying around South Texas distributing vaccines. So we literally have flown millions and millions of miles and dozens of times around the globe setting that bait out. So it's just a wonderful time. We stayed in those towns down in South Texas and got to make some lifelong friendships, across borders with Canada and elsewhere. So again, just really memorable times in my public health career that really set the stage for my kind of appetite for international work.
What one key thing would you like to share about what you do?
It's a great question. I think about it a lot. And I think the most important thing beyond the medical knowledge, right? We must continue to ensure adequate education and outstanding selection of candidates for these types of positions. That's a no-brainer. We have to keep doing that. But I also think it's incumbent for people like us that are in educational paths, but also in clinical areas, to really mentor and challenge new professionals to think about how they will advocate for not only themselves, but the profession. We absolutely are in a crisis mode, I believe, across the country with staffing, from burnout to retirements to salary issues. We've heard all of the different components around these shortages, and I truly think we're entering an area of national concern, because as you know, and we conduct over 13 billion tests a year, and on top of that, with the pandemic, we've done another million plus tests, and our workforce is tired, and we've got to find ways to let other people above us, around us, different healthcare professionals, as well as reaching down into the junior high school areas to get the word out that this is a fantastic career path with many, many opportunities to branch into different areas, whether it's one of my medical lab alumni becoming a pathologist assistant, to a physician's assistant, to going into public health. We are desperately in need of educators because of educators retiring now, and we need new kind of dedicated educators for these types of programs. So learning how to advocate, learning how to put themselves out there a little bit, whether it's writing explainer articles, whether it's conducting interviews like we're doing today, doing a podcast, or just talking with their schools, with their junior highs, with their churches, with other organizations to spread the word, so that those individuals that may not get into medical school, that may not go a certain route, understand there's some really great career paths in these areas.